Good evening, myself Haseena from the Department of Psychology. We will continue the lecture 2 video of the substance-related. So the next one is cognitive behavioral therapy for alcoholism. So cognitive behavioral therapy is also known as CBT, which involves both cognitive and behavioral techniques. So for the individuals with substance-related disorder, CBT can help the individuals to cope up with emotional and situational triggers that lead to alcohol abuse. It may lead to trigger those habits to high end. So the common techniques we use in CBT to reduce the substance-related disorders or drink refusal skill. So we can teach the patients to say no to those habits more effectively, even in common social situations. The next one is mood management. So mood management is identifying and managing their negative emotions that lead to drinking. So what are all the emotions and what are all the habits that lead those individual to intake those substances. So next one is coping skills. We can teach them to how to deal with stress and other social triggers which leads to these habits. The example is a person might usually drink at parties due to anxiety. So the CBT technique would help them to identify those situational or social triggers that lead to this type of habits. So we can teach deep breathing, bringing their body and rehearsing assertive responses. Assertive responses nothing but saying no to those substances. So we can use these common three techniques in CBT. So next one is aversive condition. So based on the classical conditioning, it pairs alcohol with unpleasant stimulus to reduce its desirability. So how the aversive condition can work is alcohol. So alcohol is a conditioned stimulus. So we can give drug that cause vomit. So we can't able to tell those individuals that we are mixing some other vomiting causes drugs into your alcohol. So we can't say that, but we can give so those type of tablets to reduce those habits. So how we can give is we can mix those tablets in their alcohol, which lead to vomiting and some other uh, some other conditions that cause the alcoholic individual to reduce those habits. So if we give alcohol with the drug cause vomiting, so that is unconditioned stimulus. Eventually the alcohol alone can cause nausea. So the alternate method we can give is electric shock or aversion imaginary or sometimes used, but or less effective or more ethically questionable. So example for this aversive condition is person take antabuse. So antabuse is a vomit causing tablet. So a drug that contains vomit when combined with alcohol. So we can after a few such experience, he or she may begin to associate drinking with feeling of sick. So if we after the aversive conditioning, if the individual wants to take alcohol, he itself feels like a sick. So next one is covert conditioning. So it involves using imagination to associate alcohol with negative condition. So we can tell the person imagine something that you are drinking at a party and vomiting in front of everyone. So how embarrassing it is. So these we can tell the individual to use some kind of imagination. So uh, it may also lead the person to think about the consequences, right? So covert sensitization is also one of the important process. The next one is controlled drinking approach. So it focuses on moderation instead of complete abstinence by teaching self-monitoring and coping habits. So controlled drinking approach is nothing but we can't tell anyone to cut off their alcohol habit or some other addiction habit immediately. So that is not even possible. So we can tell the patients to notice those triggers and how to mindfully reduce those habits. So patients can analyze when, where, and why they have started drinking. So next one is identify emotional states leading to over drinking. So what are all the emotional states that cause this individual to intake those alcoholic habits? Next one is encourages small, achievable, and behavioral changes. We can tell the patients to do the small changes, and we can give some rewards because of their achievable behavioral changes. So the example is a person notice they tend to binge drink after successful meeting. So they begin two meeting drinks with a walk or a tea. So next one is relapse prevention program. So the relapse prevention program combines both cognitive approach with variety of treatment procedure designed to change the individual's drinking pattern. So the main requirement is clients should make voluntary decision to change, so that we can't force anyone to change their habits, right? So the first important thing for a therapy is the client itself should make a voluntary decision to change those habits. So then only the therapy will work. So this approach assumes that the person experiences a sense of control over his or her behavior as long as the treatment program continues. The person voluntarily coming for to changes, then only he or she can able to continue the therapy or accept the situations. The next one is if the person encounters a high risk situation, then relapse likely. So relapse is nothing but the like the repetition of the disorders. So if the person encounters high risky situation like triggers or something, so there is a high chances to get relapse. So next one is high risk situation includes negative moods such as frustration, anger, depression, interpersonal conflict. So the approaches we can give to the client is increase the sense of control. Next one is teaching refusal skill. Just one drink. If the person wants to drink at least one sip, we should teach the client to say no. How to confidentially say no. So we should teach them. Next one is abstinence violation effects. When a person drinks after being sober and believes the lapse is due to personal weakness, they may binge further. So abstinence violence effect is nothing but we should teach the client to reframe their thought process. So instead of saying I'm failure, I can't able to withdraw this habit. So instead we should teach them to say it's okay, I had a slip, but I can get back on the track. I can able to withdraw this habits. So we can teach this type of like this type of confidential to the clients. So next one is interactional perspective of alcoholism. So interactional perspective of alcoholism is nothing but the characteristics of alcoholic individual. So the first one is vulnerable individual. Next one is triggers increases drinking. So what are all the triggers that cause the individual to do the habit again and again? Alcohol feels rewarding, and how the alcohol is giving pleasure to that individual. Next one is tolerance and abuse. Over time, they need more alcohol to feel the same effect. So which lead to alcohol abuse. The next one is physical dependence and relapse after the abstinence. So thank you. We'll continue the substance related disorders in the next video.